Hey everyone, I'm Brandon Irwin. I am part of the Flint Hills Wellness Coalition. The reason you're getting this email and this video here is because um, I'd, I'd like to invite you, and we, who I'll tell you about in a second, want to invite you to be a applicant and participant in a leadership transformation grant for Riley County. So let me give you a little bit of context here. The Kansas Leadership Center, which is based out of Wichita, is currently offering this leadership transformation grant where they award organizations across the state of Kansas 80 slots in their leadership training programs. Now, if you're not familiar with, the leadership center or these programs, that's fine. The only real thing that I think you need to know about this sort of form of leadership is that its relevance for us here is that leadership is important for addressing uh, tough problems, tough, and especially in our sense, I think, is community health problems, and we have a number of those here that we really need to make some progress on. And you can think of some that come to my mind are food insecurity, poverty, homelessness, lack of affordable housing, access and coordination of services, transportation. I mean, I think you get the idea, and again, that's not a complete list, but what's clear is that leadership is an important part of solving those problems or making progress on those problems. And um, so a group of people in the community, and it's really started just last week in the among some folks in the Flint Hills Wellness Coalition, and I'm guessing most of you know what that is, or even participate on that or in that coalition. Um, Saw this opportunity and met very briefly to kind of figure out how we were going to get our community to submit one of these grants. And said, well, let's just let's see who's interested in this. And the reason why we're sort of sending this email blast here is because this grant. Let me tell you a little bit about the specifics here. The grant is not money. It's just slots in their leadership training. So we travel down to Wichita to receive this training, and there's all different kinds of leadership training programs. I've gone through some, and I know others have as well, and have found those very beneficial. As I mentioned, it's very important, and we now have some common language to use in addressing the problems that we're trying to address. But there's 80 slots, which means that an organization can send 80 different people. They can send one person 80 times or anything in between. But if you're an organization that only has 3 staff members or something, you're not going to be competitive for this grant. They're going to look at that and say, well, there's no way you're going to use 80 slots. So but what they do allow you to do is apply as a coalition. If you're a big organization, you can apply, by yourself. That's fine. But you can apply in coalitions, and there's, if you're a nonprofit, you can apply as a nonprofit. You can apply as an education entity, a community-minded business organization, a government, or a faith-based organization. So our thinking was, well, look, I think there's enough, organizations around the community that have at least a similar underlying vision for where we want the community to go and what we see sort of a healthy community being and looking like. And maybe we can apply as a coalition and get everybody who's interested to sort of participate in this coalition and apply as a coalition. So that being said, um, this is really just to see if you're interested in applying, and also invite you to a meeting where we're going to talk about this grant on August 1st at 10 a.m. in the Family and Child Resource Center on Claflin. There'll be some directions in the email on that. And one thing that we need to do, anybody who's interested, we need in order to be competitive for this grant, we have to have a vision for how we see this leadership training, sort of fitting into our vision for the community. So at the same time, we discussed in this small group meeting. This was Jennifer Green, myself, Jess Kerr, Kevin Bryant, and Julie Hedinger at the health department. We said, wow, well, this seems like a really good opportunity to get a bunch of stakeholders and community partners together and sort of rallied around a similar vision for the community. Now, I don't know what that is, and we don't know what that is, but we have some ideas, and I'm sure you do too. And so one idea that we have in seeing that everybody who we're sending this out to, we believe has some kind of connection to community health or some kind of health-oriented organization. I mean, even if you're in USD 383 or Everybody Counts, if you're in the faith-based world, it is we view that as community health. And one of the big focus areas for the coalition over the next few years is going to be health equity, which really just means, look, we're trying to figure out how to in creating some activities and programs designed to improve the health of the vulnerable populations in our community. So our thought was that, if you have any interest in doing that, if you're doing any work that's related to that, then we have something in common, and we would like to invite you to be a participant on this grant. So the details of the grant are very simple, and I'm going to attach the request for proposals on the email. You'll see that the deadline for that is September 1st, and so this meeting that we're asking you to attend on August 1st at 10 a.m. is to figure out a couple of things. One is the most important thing is, what is this sort of shared vision? How can we really need to be able to articulate that well in this proposal, and I think we're going to be very competitive for this proposal. We really feel like we've got good capacity and relationships around the community to justify this. So creating that vision, and I'm also sending you a link in this email to just a little Google form to have you answer just a few questions. Who you are, what organization, and how many slots, how many leadership training slots your organization might want. And also a question that kind of gets at this vision. If you, thinking about community health and leadership in our community, fill in the blank here. It would be really great if, fill in the blank. In thinking about community health and leadership, it would be really great if blank. And that's going to help us, figure out this vision here. So again, invitation to this meeting, leadership training grant, 80 slots, really good opportunity to build some community around this issue of health equity or community health, and make some progress on tough issues in the community here. So fill out the Google form. If you have questions, you can email me about that. The meeting's going to be August 1st at 10 a.m. So thanks for your time. Oh, by the way, this video is just sort of like an experiment in being a little bit more engaging and being a little bit more sort of human in our communications, which I think is an experiment worth trying. So that's why we're doing it this way. So, anyways, thanks for hanging in there, and I hope to see you at this meeting.